This meeting is being recorded.
Welcome to Take Charge of My Cancer podcast, episode 15. I'm Darlene Munoz, your host, and I am so excited to have an amazing person that I've been working with for 14 years, I guess, since I've been doing college. Yep.
Yeah.
And then so she is used to be one of the nurses, still a nurse navigator, but I used to be our breast nurse navigator. And now she's working with the radiology department, but she's still in our team, and we miss you a lot, but I know I'm happy that I get to see you every tomorrow board on Monday morning, so it's exciting. So Pam Clevenger is a registered nurse, and she is a 2 times breast cancer survivor and have dedicated her career to helping patients navigate their new normal after their life-altering disease. Her goal is that she can show that there is so much hope and life left. And this disease does not mean that the life you enjoyed prior to diagnosis is over. She worked with the breast cancer team at UF Health for 9 years and the Nurse Navigator, which allowed her to help patients finding resources, making sure that they go through the entire team and run the UF Health Breast Cancer Support Group. She is the 3rd generation caregiver in her family. Her grandmother was a CNA, her mother was an LPN, and she was the first RN in her family. And taking care of others is truly a family trait. When she's not work, her family is the most important thing to her. She has been married to her amazing husband, Chris, for 31 years, and who is her rock. And they have an awesome son, Colin, who is the apple of their eyes. So Pam, thank you so much for doing this, and I'm so excited to do this with you.
Oh, thank you, Darlene. I really appreciate it. I'm honored that you asked. And 15 episodes, this is just amazing. You should be just so proud of yourself. You're doing a great thing.
Thank you,
Yeah.
Pam. So tell me about you. Tell us a little bit about your journey. You know what has been so exciting about this, Pam, that I've been working with people for years, and it's a lot of things I have no idea. We start doing these things. I'm like, oh my God, you did that and you did that. So how you want to tell us a little bit about your cancer journey?
Sure. It's a little bit of a long journey, but if we only have 25, 30 minutes, so I'll make it short. I'm just kidding. So yeah, I was 27 when I moved to Gainesville. We've been here about 6 months. And I went for my yearly gynecological exam, and the doctor said, have you had any problems? He was doing my breast exam. And I said, well, I had some pain in my right breast about 6 months ago. It went away. I really forgot about it. And he goes, you have good insurance, and I think women's breast health is overlooked. Let's get an early baseline mammogram. So we got the mammogram, and I ended up having a biopsy, and they found that I had something called DCIS, which is ductal carcinoma in situ. At the time, though, at 27, it felt like the world was imploding. I had no idea about any of that. And being 27, there was no one my age that I had for a resource. So I kind of already knew, though, it sounds crazy, but we did my mammogram, and they found a lot of calcifications. And the doctor said, oh, you're 27, it's nothing. But I knew, I don't know how to explain it. I knew. So for the day my biopsy results were supposed to be back, I called the surgeon. And I said, can I find out my results? And they said, oh, the courier's not here. Give us a little while and we'll call you. Not even 15 minutes later, they called me back and they said, oh, the doctor's going out of town for the weekend and he'd like to look at your incision before he goes. Can you come in now? And I looked at my husband. I said, I had only been a nurse 6 months. And I said, I have cancer. He goes, no, you don't. Stop. And so, of course, I got the diagnosis. 2 weeks later, I was having a partial mastectomy. So at that time, since it was DCIS, they weren't touching my nodes. So they went in and they did what we call a lumpectomy. They just removed the cancer. It was 10 centimeters long, 11 centimeters wide, and 3 centimeters deep, and they didn't get it all. So I had what they call positive margins, which meant the cancer was still kind of there. So he went in and did a re-excision to get nice clean margins. And at that time, I didn't know. I just signed a consent that said, yes, I will lose my breast, or you can either, it was a consent for either a lumpectomy or a mastectomy, which at 27 was just devastating. I woke up just grabbing my chest going, is it there? So when they came back and they did the re-excision, they took all of my lymph nodes out of my right arm.
Oh my God.
So I had an axillary lymph node dissection at 27.
Wow.
So I've been very fortunate. I've been working with you guys for years now in physical therapy, and you guys have helped me get rid of any lymphedema that I've had. So you guys are my lifesavers, because if I had developed lymphedema, I don't know how I could have continued my career. So thank you.
Okay. No, thank you, because you're the one who is so proactive. Our goal is to teach you what to do so you can just continue living a normal life, hopefully without no complications. So yeah.
Yeah. So then we waited for 10 years until I was 10 years cancer free before we started to try to have children. And then I was blessed with my baby boy, and he's not a baby anymore. He's almost 15.
Wow.
But he was 5 months old, and I developed redness in my breast, and they kept thinking that it was mastitis because I was 6 weeks postpartum. So for about a month and a half, they just kept putting me on antibiotics. And finally we got a mammogram, and I found out I had a recurrence of the DCIS.
Oh my
So at that time I had to have a mastectomy because I'd had radiation the first time and 5 years of tamoxifen. So I said, if you're taking one, you're taking both, just so that way I don't have to worry about it anymore. And so I went in and I had bilateral mastectomies. And at that time, when we had my final pathology, I found out I had a recurrence of the DCIS, which is a small area. I had 3 1-centimeter tumors of invasive cancer, and I had Paget's, which is a cancer of the nipple. Yeah. So we did all of that. And then I had my reconstruction, and then we found out I needed chemo. So and this was all while my son was 5 months old.
Oh
my husband and my friends are just, my tribe is amazing. So I went through, when he was 5 months old, I went through 4 rounds of chemo. And then I had to have hysterectomy because I was too young, and we needed to get rid of my ovaries. So we did a hysterectomy, and I did 8 years of Arimidex, which is an aromatase inhibitor. It's a pill to block the estrogen. So I've done, the hardest part was, I think, my reconstruction. I had what they call the deep flap. So it's where they move the tissue up from my belly. And I'm a rare case. I was the first one at UF Health. And I was in the OR for 16 hours.
Wow.
And overnight I said, I don't feel well. I feel like my blood pressure is dropping. They said, oh, it's fine. They checked it. It's fine. Well, it turns out the coupler holding my vessels together popped apart. And so I was bleeding inside. So I had to go in and have emergency surgery. And I had 13 transfusions.
Oh my God.
9
Yeah.
plasma. So it's okay. But, they couldn't find a pulse for an art line. It was really scary. So, but I'm here, I'm blessed, and I'm grateful.
Okay. Wow. What a story. You see, I'm telling you, I didn't know half of this story. I'm telling you.
I could probably tell you more, but that would be a whole nother podcast.
Exactly. So when did you, and I know we're going to talk more because you're a nurse navigator, and you're going to be my guest when we talk, because we can talk about nurse navigators for like hours. But when did you make a decision to become a nurse navigator? In a little short, don't tell me too much, because then we're going to talk more about it later.
Yeah, I kind of fell into the position after chemo. I always say there's a reason for everything, and God has a plan. You may not know it, but you'll figure it out. And I was going back to work after having chemo. I was pale. I had no hair. I had a hat on my head, and I had to go up an elevator to go to one flight to go to the OR. And a lady was crying next to me in the elevator. And I said, ma'am, are you okay? Is there anything I can do? Just being me. And she said, well, I'm going for my mastectomy, and I'm scared. And so we got off the elevator. I took off my hat, and I said, I'm just coming back from chemo. Can I hug you? And right then and there, I knew that somehow I wanted to work with breast cancer patients.
Oh, wow. That means to be, wow. That's a very good answer. You kind of make me a little tear here. Emotional here. Wow.
Yeah. So that, my role has changed a little bit, but I'm still doing what I feel is good work.
That's amazing. And Pam, you are amazing. You're amazing.
Thank you.
Not just from like being a coworker, but just as a human being. So that you're just amazing. So
now you're making me misty. Stop.
So what would be 3 valuable tips that you learned from your journey that you can share with our audience?
I think the biggest thing, the difference between the first cancer and the second cancer was, I know I need one too. The first cancer and the second cancer was that I was new to Gainesville the first time, and I was 27. We had no one. And it was really a dark time because we were by ourselves. The second time was so much stronger because I have so many great friends, and people just wrapped their arms around me. My friends, my coworkers, they all became my family, and I can't thank them enough. So I think that's one thing, is ask for help,
Mm-hmm.
because usually we don't, and it's there if you need it. Don't go through it alone. That's the biggest thing I can recommend.
Mm-hmm. Yep. Yep.
Also, I think reading books, there's so many websites and there's so many books out there. I think just um, knowing what to expect, but even so, talking to your partner or your family, if you have someone. My husband would see things in me that I didn't even see. He saw that my head was itching, and it was because the chemo in my hair was starting to fall out, and I didn't even realize it. I saw him walk behind me. I was like, "What are you doing?" He goes, "Well, you're going to shave my head, and I'm going to shave yours." So we sat in our kitchen and shaved our heads. So just ask for the help, know your support, and really lean into it. And don't try to do it on your own, because it's not good for anybody.
Mm-hmm. Yep. Any other tip?
Be patient with yourself, because I look back at my journals and I was really angry. And I think giving yourself the kindness and the patience that I didn't give myself is important, because this is the time that you have to be selfish, and you have to say, you know what, I'd love to come here, but I can't. You need to just listen to your body, and you need to be patient with it. Know that this didn't happen in a day, and you're not going to recover in a day.
Mm-hmm.
So really give yourself that space.
Yeah. But you always will recover.
Always.
Always recover, because I love to see, like, patients like you in the beginning, right? Because we see them right like 2 weeks after the breast surgeon see them, Dr. Spiegel, and then so is the fear. Everybody is scared, you just got this diagnosis, and the only thing you can think is, man, who's going to take care of my family, because I'm going to die, right? Because I have this cancer. And then all of a sudden, then I see the fear goes, and they have surgery. We see them 2 weeks post-surgery, and then it's like, okay, surgery is over. We have the results, now waiting on the test to see what else needs to get done. And when all that happens, then I start to see this ease. And then, yes, you have some, effects from treatments, but like you said before, if you have a good team that you're working with, besides your family members and your friends, but you really have a good multidisciplinary team that can help you and
Absolutely.
guide you, then that makes things so much easier, and things doesn't have to be that hard if you have that team that have the knowledge to help you how to navigate through that, to try
And
to
that's the
mitigate some of
difference.
those symptoms. Yeah.
My first cancer, I went to a local hospital that was Alachua General at the time, and we didn't have a multidisciplinary team. It was such a different experience that I can't say it enough. I actually speak to some of the med students about what it's like to come to a center of excellence, if you will, as opposed to just an outside hospital. The difference is night and day.
Yep.
People here in our team really care, and they want to help patients. And I think it's huge.
Yep, absolutely.
Yeah.
How about your most painful lesson through your journey?
I'm not Superwoman. And I'm not going to be here forever. Dang, when you're young and you think you got it all, and then it's like, dang,
I
I'm not.
like that.
Yeah, I'm not superhuman. I try to be, and you're not. So that's the most painful lesson, is that, and I'm not going to be here. I've had it twice before the age of 40. It's probably going to come back. It may not be till I'm 90. I knew the first time, and the second time driving to my mammogram, I was listening to Sarah McLachlan's Angel, In the Arms of the Angel. And I was driving, and I thought, they're going to find something. And I said, no, they're not. Stop. You're 12 years cancer free. Stop it. I'll be darned if they didn't find it. So, it may not come back till I'm 90, but if it does, I'll fight it again. I don't give up.
Yep. No, you don't. Okay.
And nobody knows anything. You could, everybody's got a risk of that something,
Yeah. Yeah.
You just can't let yourself dwell in it, because if you do, that's where the problems. You need to know that, I promise you, all those women out there who are fighting, I promise you, you will go through a cycle, and you will have the down days, and you will cry, and you will be angry, and you'll be frustrated, and you'll be ticked off. But I promise you, there's going to become a day when you don't think about breast cancer every single day of your life. Oh, I see my scars. Oh, they're scars. And then you just go on. Whereas so many women, you have to, they're so scared and so nervous in the beginning. And I just try to tell them, I promise you, this too shall pass. And you just need to know that there is a light at the end of the tunnel. And it will come.
Yeah, awesome. Is anything that you have that will be a value for our audience, and will you share that with us?
I don't know if I have anything. Everything I give, I'm such an open book. I tell everybody everything. I don't know if I really have anything that I could give other than the advice I've given.
How about when you went through your hormone blockers, endocrine therapy? Anything that you can advise to our audience in regarding, how to
It's
deal
rough.
with the hormones and what helped, what didn't?
Girl, it is rough. I had severe foot pain that ended up in both feet. There were days when I couldn't drive the car home because my feet hurt so bad. But you know what? I was not willing to come off the medication because it was my safety net. It was blocking that cancer. So I think that those are tough, but I do tell you that once you become accustomed to the medication, the symptoms do subside. And I found that, I have a ceiling fan and an oscillating fan for the night sweats. You just learn to adapt.
Yeah. And then, sometimes I hear that a lot, of course, in our patients, but sometimes I tell patients it's options. So if you've been putting in something, it's not just one thing that can help. So I always say, don't endure it. Go ahead and reach out to your medical oncologist.
Correct. There's so many different medications out there that if one doesn't work, stop it and we'll try another.
Exactly. But before you kind of like giving away, then just really try to try other things before you say, no, this is absolutely, and I tell them as well, right? And then it's all about quality life. Now, if you feel you're miserable and you try everything, again, talk to your medical oncologist and see, what are the risks, what is the benefits, what really it is worth it.
Correct.
If you're miserable and your quality of life is just terrible. So,
and they have some new tests that they can do now to tell you what your real benefit is with this medication in 5 years. I don't remember, and I apologize. It's been years since we ran mine, but they can tell you what the benefits of this medication are. And if you're truly struggling, talk to be honest with your doctor, though. Don't try to suck it up and, like I didn't, say, I gotta take it. Because once we got it's called the breast cancer index. That's what it's called.
Okay.
And it will give you what the risk of recurrence is without the medication in 5 years. So I think it's a great tool, but there are so many different, and there's medications they can give to counteract the side effects of medication. So talk to them.
Okay. You said you have a support group, Pam. How can they find you?
So I don't have a support group anymore. It's on hold because my new job doesn't allow, I can't do it. So right now it's all on hold.
Oh, okay.
But I will tell you there's, sorry?
Can they find you another way?
I think I'm hoping Stephanie's going to take over my new, but we'll have to see. But I will tell you that I find there's a great website called breastcancer.org. And it is the best online support that I can find. They have chat rooms and people on there that's ran by survivors. So they get on there and they give you information. And if you're struggling, it is really helpful. Okay,
perfect. If they want to reach out to you to get any advice, how can they find you?
I'm on Facebook and I'm on Instagram. So either of those places, just Pam Clevenger. I think on Instagram I'm Pam Clevenger 1 and on Facebook.
I'll put that information on the description of the podcast so they'll have that. Perfect.
Sure. And my email is pamclevenger07@gmail.com. You can always reach out if you'd like.
Okay, awesome. How about any 3 books that you recommend to our audience?
I recommend 2. There's one, Dr. Susan Love's Breast book is the Bible of breast cancer. So it's been around for years. I find that it's really, really fantastic. And there's another one that I like. It is actually by a physician that trained here. It's called The Simplified and Sometimes Sassy Guide to Breast Cancer. It says, like if your best friend was a breast surgeon, and it's by Brittany Mathias, and she breaks it down. And you can get it on Kindle Unlimited. It's a great book. I was laughing out loud in a lot of parts. So I recommend that one as well. Those are the 2 I would recommend.
Perfect. Will you text me those? And I'll make sure that I put it in the information for people.
The link, sure. Yeah. Happy to.
Thank you. How about any podcasts?
No, and that's why I'm so excited for what you're doing, because I don't think there's a podcast out there that is patient-centered and keeps the whole, like, the reason you're so amazing is because you actually are involved. You know,
Mm.
I haven't really told you this, but I've always respected you because you come to tumor board. You listen. Sorry, everybody, we have a multidisciplinary team that we meet every Monday, but you actually come and you care and you think about the patients and you listen to the plan, and you're so much more than a physical therapist. You
Thank you,
truly are.
Pam.
You're a huge patient advocate.
Mhm.
And you know, you're growing this program, and lymphedema is such I've had it. I actually had to change jobs because I had to wear a sleeve for a while. And it is such a it can be a debilitating thing if it isn't caught. So what you do is so important.
Okay.
But you are such a huge patient advocate, and you actually really have made this program amazing, and thank you for what you do.
Thank you, Pam. Oh, you're so sweet. Thank
No,
you.
but I hope this podcast is changing it. I love it. I think it's amazing.
Thank you. That's what I'm
Yeah.
trying. I'm really trying to just put education out there, so it make a little bit easy things for you
Yeah.
guys' journey, because it's
Yeah.
not an easy journey. So if anything I can do to help it, that's exactly what I'm trying to do.
And breast cancer is no longer an acute illness. It's a chronic disease.
Mhm.
And there's going to be things the entire rest of our lives that are a new normal that we
Mhm.
have to navigate and figure out what's next, or, oh my God, there's a lump. Now what do I do? Or what's my imaging? Or my arm is swelling, or I can't lift my arm to reach up to get the dishes out of the cupboard. There are
Mhm.
so many different things that are
Yep.
affecting us now, and women are getting younger and younger, and they have
Yep.
so much more life to live.
Yep.
So,
Absolutely. Yep. How about movies? Is any particular movie that you would recommend?
good Lord. You know what? They're all like, when I watch these movies, they're about breast cancer, but I love Stepmom with
Mhm.
Susan Sarandon and Julia Roberts.
Uh-huh.
Um, I like, what is it? Oh, The Family Stone. It's got
Okay.
Diane Keaton. That's a good one. I think that's really the only the two that I liked, but about breast cancer.
Okay. Perfect. Is anything that you wish I have asked you that I didn't, that you wanna share as your last tip before I let you go?
Oh, I talked a whole lot. I'm sorry.
No, you're done. I love it.
So I'll tell you the one thing, we touched a little bit on it, but my thing is the families. They're kind of forgotten in this. And, I want them, my husband, I wouldn't be here without him. Ugh. And I know he struggled.
Mhm.
So that's my thing, is I just wish there was more resources for families.
Okay. Okay. That's good. That's good to know,
Mhm.
because I know how what we can do to try to implement that. And some of the things I'm trying to do with this podcast is really try to bring everybody from the interdisciplinary team, including mental health.
Mhm.
And the mental health, not just for you guys, but as well for family members, because
100%.
it is 100% right there, right? Because it is, the fear is not just on you, but your whole family.
Yeah.
So I hear the story of like little kids, right? How do I tell my 5 or my 7-year-old that I have cancer?
I have I have
And
some great resources for that. If you need those, I'm happy to send them to you.
yes,
I have
please.
some great articles that I found,
Okay,
like how to talk to your children with breast cancer, and it breaks it down to age group so they understand.
that's
I have
awesome.
some really great resources. I'll send those to you.
Yes, please, because I have come across some of, like, young
Sure.
women with children that sometimes that's tough. So
Yeah.
I'm trying to again reach out there and try to see what else can we do to bring that education to you guys as well.
I'll tell you, my son found out I had cancer via YouTube
Oh wow.
because I had done an interview, and he searched me one day, and he was 11, and he came in the living room, and he looked at me with tears in his eyes. He goes, "Mom, do you have cancer?" And that was the one conversation I had dreaded my whole life. So talking to children is tough.
Yeah, but I
But
think it's super important though. I think that you cannot hide that from them. And it
no,
is amazing how they can be more part of it, of course, using the right language and the right things, right? Depending
yes,
on their age.
yeah,
But it is important because if you don't want to hide it from them, because they need to learn what you're going through. There's nothing wrong with that.
no,
And they can be more supportive than what you think. And that's
sure.
going to really relieve a lot of stress because everybody's on the same game.
Even cuddles, they help so much. You know, it's that skin to skin tactile contact. If you just give your baby, give your child a hug, it's good for the soul.
Yep, absolutely. Pam, you're amazing. And I can't wait to do the next podcast talking about all the wonderful things you do as a nurse navigator.
Well, I appreciate you. Thank you, Darlene, and thanks for doing this. This is our long overdue and needed. So thank you.
No, thank you so much for being here with me today.
All right. You have a great weekend. Thanks, Darlene.
You too. Bye.